Hello, everyone. My name is Shin, and I'm the CEO of Hoon. Thank you for joining today's presentation. Today, I would like to present a non-contrast city-based AI solution designed to screen for emergent large vessel occlusion and provide timely notification. Next. Hoon's journey began from my desire to address unmet needs that I encountered as a neurologist in my clinical practice. Our focus is on leveraging AI to diagnose brain conditions like stroke, Parkinson's disease, and dementia through medical image analysis. Our solutions utilize different imaging modalities for each condition. CT scans for the rapid interpretation of emergency stroke, MRI and PET-CT scans for more accurate and precise diagnosis of degenerative brain disease. Next. In stroke treatment, time is of the essence. As time passes, brain damage progresses. Making rapid diagnosis and treatment is crucial. When treatment is delayed, the chances of full recovery decline sharply. This is why stroke is the second leading cause of death globally, resulting in a significant loss of years due to premature death and disability. Slovakia, like many other countries, is not immune to the threat of stroke. Approximately half of all Slovakian deaths can be associated with behavioral risk factors, which is higher than the EU average. Such factors will likely lead to a dramatic increase in stroke cases. A typical treatment procedure for acute stroke patients is as follows. Upon arrival at the hospital, the patient first undergoes an NCCT scan to determine the presence of cerebral hemorrhage. If the ischemic stroke is suspected, a contrast in a CT angio is performed to check the elbow. The subsequent treatment decisions are made. This entire process typically takes 3 to 4 hours in a hospital setting, but can vary depending on the region or country's healthcare infrastructure. If more than 6 hours have elapsed since the onset of the stroke, only 16% of patients will recover without significant symptoms. However, if treatment is given within 3 hours, this recovery rate increased to 43%. This stark contrast clearly demonstrates the importance of rapid treatment. Within the general workflow for stroke patients, several time-consuming moments can arise during the diagnostic process. These delays can occur at various stages, from initial imaging and diagnosis to treatment decisions, depending on the hospital's infrastructure and the availability of specialized stroke care. In smaller hospitals, delays often arise due to a lack of stroke imaging specialists and insufficient infrastructure for treatment like mechanical thrombectomy. This can lead to delays in making transport decisions to larger centers. In thrombectomy-capable stroke centers, challenges including managing high patient volumes and coordinating medical teams for emergency procedures. Next. At Huron, we aim to address these time-consuming delays that hinder better stroke outcomes. The Huron Stroke Care Suite is an AI-based priority classification and alert system for acute stroke patients. It screens for acute hemorrhagic stroke and large vessel occlusion in patients through non-contrast CT imaging in just 3 minutes. The Huron Stroke Care Suite provides automatic classification and alerts for patients suspected of having a hemorrhagic stroke or acute large vessel occlusion. This supports medical staff in making swift diagnosis and treatment decisions. Huron ICH conducted the blind leader study approved by the Korean Ministry of Food and Drug Safety. In this study, the sensitivity and specificity of ICH were 96% and 95%, showing 95% of accuracy. Next. Huron elbow is a solution that predicates large vessel occlusion on non-contrast city brain city despite of not vessel imaging by using three findings: the dense MCS sign, early ischemic changes, and eyeball deviation. Next. Huron elbow conducted the later study approved by the Korean Ministry of Food and Drug Safety, and in this study, the sensitivity and specificity of elbow when read without AA assistance showed a significant improvement from 76% to 92% and 83% to 93% respectively. And the interrater reliability of agreement was improved from 0.27 to 0.75 and obtained approval as a Class 3 medical device. This is a paper published in JNIS. Two experts with over 10 years of experience assessed aspect score, and the agreement between the Huron product and the experts was calculated. The interclass correlation coefficient score as ICC, demonstrating the agreement between the two sets of results, was 0.78. It indicates good to excellent agreement. In a recent external validation study with a large data set of 973 ICH cases and 502 elbow cases and 1,333 negative cases collected from multi-center, Huron ICH performance for detecting cerebral hemorrhage was measured with a sensitivity of 95% and a specificity of 99%, while Huron elbow for predicting emergency large vessel occlusion showing a sensitivity of 82% and a specificity of 94%. Huron stroke care suite is not only easing clinicians' workload, but also reducing significant amounts of time consumed for stroke diagnosis. How will we do? It is simple. Large vessel occlusion cannot be easily detected with non-contrast CT scan. So if NCCT shows no abnormalities, clinicians need to decide to order extra imaging tests such as contrast CT or MRI. However, since our solution can detect hemorrhage and elbow with non-contrast CT, we can eliminate extra time to decision for additional tests as well as waiting time for it. We aim to make this pathway as a new standard for stroke diagnosis. We've achieved an important milestone by getting FDA 510(k) clearance for our Huron ICH solution. It's the first Korean AI tool for triaging suspected intracranial hemorrhages using non-contrast CT scans, resulting from clinical research conducted with Harvard Mass General Brigham Hospital in the US. Also, the Korean Ministry of Health and Welfare recognized our stroke solution as an innovative medical technology. The Huron Stroke Care Suite can be used in clinical settings as a non-reimbursable technology for 2 years. In a Hungarian hospital that adopted Brainomics' stroke suite, data were analyzed for 7 months before and after the introduction of AI solution, and CT to groin function time was reduced by 16%, although not significant. And the number of mechanical thrombectomy was increased from 11 to 19. And although not statistically significant, the result showed excellent outcome with MRS score of 0 to 1, increased from 18% to 37% after 3 months. A study of effect of Biz.AI on thrombectomy treatment time in 4 comprehensive stroke centers in Texas showed a significant reduction in door-to-groin time by 11.2 minutes, CT to EVT time by 9.8 minutes, and a significant reduction in mortality from 31% to 13%. We conducted the study aimed to investigate whether the use of patient triage system in an emergency room for acute ischemic stroke patient could shorten treatment times. In this study, emergency doctors utilized the Huron AI solution and additionally received text messages. The study compared the time period before and after AI usage. This study compared the time metric of patients who presented to the emergency department during the period from January 2022 December 2021, before the introduction of Huron stroke care suite, and from May 2022 to December 2023, after the introduction of Huron stroke care suite, and were diagnosed with acute stroke caused by large vessel occlusion from the ICA terminal to M1, and underwent TPA or mechanical thrombectomy. The primary outcomes were door to IVT time and door to EVT time, while the secondary outcomes included CD to NR time, CD to IVT time, CD to EVT time, and changes in NHS scores and MRS scores. After introduction of Huron stroke care suite, door to EVT time decreased significantly by 30 minutes, CD to NR time by 16 minutes, CD to EVT time by 29 minutes, and the discharge NHS score decreased by 4.3 points compared to the initial NHS score. In respect of functional outcomes, although statistically not significant, it showed the tendency of better MRS at 3 months. After utilizing the AA solution, the time from CT image to stroke team's initial care and to IVT2 or EVT were reduced compared to before the application. Huron stroke care suite will be a useful tool for clinicians to make fast decisions, especially it will be valuable in remote regions where clinical experts may be limited. Thank you for your attention.
Thank you so much. Thank you. Do we have any questions on Slido? Not yet. Okay. Thank you so much, Professor. Thank you.